Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, I'm going to be demonstrating how to assess peripheral pulses. This is done routinely as part of your cardiovascular assessment on your patient. You are checking their circulatory status. So a couple of tips when it comes to checking peripheral pulses. How long do we do it? Typically, you only have to do it for about 30 seconds and then multiply it times 2 to get your rate. If there is any irregularities whatsoever, do it for the full minute, okay? What are we looking for? We're looking for the rate, so how many beats per minute. The rhythm, is it regular, irregular? The intensity, okay, so how easy was it for you to find? So that's this scale here. So if you couldn't find it at all, it's 0, it's absent, right? If it was difficult to find but you were still able to find it, it's 1, which is diminished or weak. Sometimes we even use the word thready. +2 is normal, expected. 3 would be full or an increased pulse. And then 4 would be a bounding pulse. So that's the intensity. And then just another little thing, if you have 2 of something, right, we always want to compare sides. So if you're taking somebody's radial pulse on their left hand, you also need to compare it to the radial pulse on the right hand. They should be the same, okay? So if you have 2 of something, compare them. So now that we know all this, now let's actually do it. Let me show you the places to take it. When assessing a pulse, we're going to use the pads of our fingers. The temporal pulse, right in front of the ear. The carotid pulse is located in the groove between the sternomastoid muscle and the trachea. This is usually one of the easier ones to find. The carotid pulse, we want to make sure we never examine both sides at the same time because the patient could become dizzy and lightheaded and even pass out. Your brachial pulse is pretty easy to find too. So you have your elbow here, right? You have the crooks of your elbow. This is called your antecubital space. So if you take your 2 fingers, you go down the middle and then you go slightly down, it's right here. To find the radial pulse, you're going to take your 2 fingers, follow down the thumb, and it's right here at the wrist. The ulnar pulse is just across. So following down the pinky, and your ulnar pulse is right here. To find the femoral artery, have the patient lie down supine, and it's located between the symphysis pubis and the anterior superior iliac spine. I will demonstrate this one on a mannequin. For the femoral pulse, it's best to have the patient lying down supine. This one you're going to have to put on gloves for. And we're going to palpate the area with our 2 fingers, just like everywhere else, but we're going to find the inguinal area. So we're going to go about right here. And then the same on the other side, about right here. So comparing both sides. The popliteal is the most difficult one to find, so the best thing to do for this is to get your patient in the right position. So that could be prone, which is on their stomach with their knee flexed, or the position we have our patient in, which is where they have them gently kind of rest their knee and then have their foot be flat on a surface, like the bed or the floor or something like that. And then you're going to take your 2 fingers, you're going to go underneath their knee, and it's going to be more towards the inner part of their body. It's going to be more over here on this side is where you're going to feel it. To find the Dorsalis Pedis, you're going to place your fingertips between the first and second toe. So follow this line and go about halfway up the foot. So it's about right here. The posterior tibial is located on the inner side of the ankle, so closer to the body side. And then you're going to feel for the bone and then go right underneath of it. So that was my video on peripheral pulses. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.